I know it looks junky, but stay tuned for my ICU RN bag pack. We're gonna get everything organized and I'll show you all the things you need to have in your bag as a registered nurse. Welcome everyone to the Momma Nurse channel. I'm Vanessa and here we discuss all things nursing, motherhood, and lifestyle. Make sure you leave a like on this video and a comment down below. What's your main thing that you have to have in your RN bag? Or if you're just starting out, what's something that you're thinking about putting in your RN bag? Leave a comment down below and don't forget to subscribe to the channel so you don't miss out on any uploads. Okay, so let's start getting organized. As you know, I'm just getting back from vacation again. So anytime I take a vacation, I make sure that I reorganize my work bags, wash them, whatever I need to do. So this time was no different. I'm actually switching out my work bag this time around. So we're gonna be swapping it out. This was my previous work bag. I keep my work bags pretty simple. This one I got from Walmart, I think. A little fastener here and one little zipper on the inside. It was okay, I liked it. I think it was back in November we went home. That was on my other vacation. And my mother-in-law gave me this bag. Anytime she goes through her stuff, she shares with me, which I love. So it's kind of vintage. Maybe not vintage, but it's a Ed Hardy brand bag, and I love it because it has all of these zippers. It has 4 zippers here, has the straps, has a little magnetic clip there, and it also has a zipper on the inside. So it has a zipper here, and it has 2 pockets here, and it's pink. Pink is my favorite color, so I'm really excited to use this new work bag. It's gonna be very functional, keep everything separated and clean. So let's get into our work bag organization. So this is not gonna be in any particular order. I'm just gonna kind of grab something, pack it in the bag, and we'll kind of see where everything fits as we go along. Because like I said, it's gonna be my first time using this specific bag. So we're just gonna kind of organize it and see what I have. So let's get started. My main thing that I absolutely have to have in my work bag, my planner. Always have to have a planner. A lot of times as nurses, you know, we get our schedules 6 weeks in advance, give or take, 4 to 6 weeks. So sometimes somebody will come up to you, hey, can you work this day for me? And I'm a person, if you ask me something, I'm willing to do it, but I need to check my planner first. Because if I already have something planned with my family, no, I cannot switch with you. But if I'm free, I got you. So I always keep my planner with me. That way it's handy if somebody asks me to switch a shift, or if I'm looking to pick up overtime, I know exactly when I can do it. So I always have my planner. Always have to keep my wallet. I got this one, I think last year or maybe the year before. Keys, that's a given. So I'm gonna go ahead and put the keys in this front bottom zipper. Keep it sanitary and away from everything else. My wallet and my planner I put in the larger compartment. Next, my work ID. I can show you that. So this is with my travel agency. My badge reel says "Be Stronger." I got a whole bunch of these from Amazon, so I just swap them out periodically. So we have "Be Stronger," just a mental reminder to just always be as strong as you can and do your best. Because it's a little bigger, I'm gonna put this in this inside zipper. Perfect fit. I always keep some type of a feminine products pouch. In here, I'll have menstrual stuff, mouthwash, a little toothpaste, must have hand lotion. I also always have hand sanitizer, but I honestly don't know where it is right now. This is my tried and true Utterly Smooth. I honestly get this from Dollar Tree, and as you can see, it's almost done. But I did want to show it to you because I absolutely love this one for my 12-hour shifts. Clinically proven to give you 24 hours of moisture. I wouldn't say it gives you 24 hours, but honestly, when I wash my hands and put this on, my hands feel nice and smooth, and it helps me get through my shifts. So I have to buy a replacement of this one, but in the meantime, I have these that I got in my stocking stuffer this year. So I just have some Bodycology lotion. It's in the scent Mocha Latte. So I'm gonna put that in my work bag. Always have to keep lotion. Always, always, always. We wash our hands so much. I don't see how anybody goes through a 12-hour shift without lotion. So lotion, and then I always keep some type of feminine spray. So this is the same, it matches this one. So these are gonna go up front. And chapstick. I love the Vaseline chapstick. Also a hair tie for those emergencies. Nowadays, I do always wear my scrub cap. Ever since COVID started, scrub caps have become my norm. I typically wear scrub caps, but for those days when I don't and I'm about to get in something messy, I always try to keep some type of hair tie so that I can put it up quickly. One thing that I did forget that's not really nursing related, but headphones. I always try to keep headphones with me because why not? If you're having lunch break or something like that, it's nice to be able to block out the sound of the hospital, pop these in, listen to some motivation, listen to music, whatever is gonna get you through the rest of your 12 hours. Always keep headphones with you, I promise you. We have my stethoscope. This one is a Littmann. I don't remember the exact name. Oh, here it is right here. A Littmann Cardiology 3. So it looks like this. I've had this one. This is probably in my 7 years of nursing. This is probably my second stethoscope, like besides nursing school stethoscope. And then I had a pink one originally. And when I went to do, actually I remember when I went to do my first travel assignment back in 2017, I wanted to upgrade, so I got this one, my absolute favorite. It works well, the quality is good, it's durable. I can hear all the sounds that I need to hear. It has not failed me yet. I have this little charm on there. You can, if you're a new nurse, you can get little charms for your stethoscope. This is my birthstone, a sapphire. Then it has some jewels around it. I love it. It's my favorite. But if there are any companies out there that think they have a better stethoscope or one that you would like me to try out, I do have my contact information down below. Reach out and we can collaborate. Last thing that I have is my little pen sack. So this is called a Home Cube. I got this from Amazon a couple years ago. It's pretty packed. I do need to reorganize this, but I haven't done it yet. But some of the things that are in here, I have my little notebook that I take notes in. If there's something important that I want to keep track of, I put that in here. A little dry erase board. Obviously, I've used it and I wipe it down so the marker has come off or the markings have came off. I have my little eraser on top so I can just easily erase the previous nurse's name. I have my PenLight. This one I'm actually exchanging. I had this one first, but I got this from Amazon as well. It was a 2-pack. But like I said, I wiped down my stuff, so this one is kind of fading now. So I have my backup that I will put batteries in this one and swap it out. My scissors, I love these scissors. I got these from my pharmacology? Mental health teacher, mental health and med-surg, I think he taught. In nursing school, he bought us all or made us all little gift bags before we left nursing school. And I've had these scissors ever since. So they're my favorite. Permanent marker, gotta have this for dating your dressings and anything else that you may need a permanent marker for. Did have this one that I'm about to put in the trash because it ran out of ink right before I went on vacation. So I have my replacement. I always try to keep a multicolored pen for my updates. So what I do when I'm giving report or getting report, use a black pen, regular old black pen for day 1. I like clicky pens because it's just easy to work with when you're at work as a nurse, rather than opening a cap and trying to keep track of it. So black pen for day 1, day 2, 3, 4, whatever the case may be. Then I use either blue, red, or green as my updates. And I use that color throughout the whole day. That way, when the oncoming nurse comes on, I know exactly what my baseline stuff was, and I now know my updated information. If it's the same nurse coming back from a previous shift, I know that I only have to give them that specific color of information and they'll be up to date on everything. So that's a good tip when you're getting report. Get a multicolored pen, or you could get single colored pens, which I have those as well in my little pack, but I just find that this one just works better for me. A pulse ox as well, just in case, like if something's going on and I need one handy, I have my own. Another thing that I like to keep with me is hemostats. People, when you open, let me go ahead and tell you, when you're doing a surgical procedure and you open some of those supply kits and things like that, there's always multiple hemostats in there. If one, they never use all of them. If one is not being used, when it's time to clean up, grab a pair, keep them handy. No lie, right before I went on vacation, there was a nurse in the Pyxis. She was grabbing morphine for her patient and her count was off. So I happened to be walking by. I was like, are you okay? Because she was like stressed out. She was like, yeah, there's a morphine that's stuck down here and I can't get it out. So I was like, okay, let me help you out. Went and I looked at the situation. I was like, I have hemostats. So I pulled them out of my pocket. We tag teamed it out. I gripped the morphine. She was able to use her other finger and pull it out, and we were able to get it out so her count was correct. So these come in handy so much. Grab a pair, keep them with you. I actually have a couple. The last thing I absolutely have to have, my report sheets. Very functional, can write down my meds on the back. Let me know if you need access to this, because I was thinking of making one that is a little bit more functional to put on my website. So if you're looking for new report sheets, or nurse brain as we call them, please let me know and I'll be sure to share these with you. I love these. Like I said, I'm a tried and true type of girl. Ever since I started using these, I've absolutely love them. It's a head to toe assessment. That's typically how, as an ICU nurse, we get report from head to toe. So it goes in that order. It has space for whatever you need to write, and it works. Just keep it in a regular folder. That way it's handy and organized. When those patients expire or get discharged, then I go ahead and put them in the shredder. So these are my report sheets. Must have. I know a lot of nurses will just get a blank sheet of paper and they'll write down the systems of the body and do it that way. I just like to have it. I don't want to have to do that. I don't know. I like to pull out a piece of paper and just write. So for me, this works. Which one do you prefer? Do you get a blank sheet of paper and write your report that way, or do you have some type of nurse brain that you've already printed off? Let me know down in the comments. I do have also some extra earpieces for my stethoscope, and then besides that, it's just some extra pens, a pencil, things like that. I just need to get rid of. I'm a pen hoarder, so I just need to get rid of some of these extra pens that no longer work. So I will be doing that soon, probably today before I go back to work. So that's basically it. I've said this many times before. I'm not really fancy. I don't have to keep up with the Joneses. That's not me. It's not my personality. So what works for me may not work for you. Somebody might say, oh, I could never carry a Ed Hardy bag, but look how small this is with everything that I just showed you. Everything is organized. Everything is accessible. So I don't know if you guys can really see, but everything is in there. The only thing I would add would be my cell phone in this top pocket here so that I can quickly pull it out and just make sure that like my family isn't calling me or anything like that. So then I am ready for my shift. And like I said, ever since COVID hit, I don't bring any of my work stuff home anymore. I keep everything in my car, in the trunk, things like that. I take my shoes off, take my scrubs off, leave it in the car, come home, wash it, whatever the case may be. So RN work bag, ready to go back to work. So what's something that you have to have in your RN work bag? For me, top 2, lotion, extra pair of N95 masks. Gotta have it. Comment down below, let me know your must-have for your RN bag, and I'll see you in the next video. Until next time, all love.